Perfect. Well, we'll get going. I can see that just the look on everyone's face getting antsy. Time is becoming very important in this whole process. I'd like to thank everyone for joining us this morning. Just for your information, we are recording this session so we can make it available to anyone that didn't get a chance to watch it. And I'll leave that up to Paul and Alan to get that information out there of where to look at it. We're just into, I guess, week 2 here in Ontario of social distancing and now physical distancing. I'm not the medical person in the room, but I think we're 15 days away from seeing what the result of this will be and how much longer we'll be in this position. Thank you to our members of government that are here this morning, Bruce, Stanton, Dunlop, and Steve Clarke. We will work with you as best we can, getting the information up to you that we're getting from the businesses in the Orillia area. And I think if we're going to keep trying to figure out how to do this as best we can. I know Bruce and I have spoken about a couple ideas. Jill and I will get together and chat at some point, and Steve and I have been sharing some communication. But in the effort to get everyone back to work here, I'm going to turn it over to Carmine here if you'd like to lead us with what's happening at Soldiers.
Sure, happy to. Thank you very much. Thanks for the opportunity to bring people together. And I want to start by thanking the community. We have seen an outpouring of community support in a variety of different ways, from donations of personal protective equipment, general acts of kindness, people dropping off food for the night staff in the hospital, and the gratitude that people are sharing with us. One of the nurses at our assessment center was saying she's never been so well appreciated by people coming through the center, just getting some information, education, and reassurance. So all that is really want to extend that to the community. It's important because the OSMH staff, they will absolutely rise to the occasion. However, they're human beings with fears and uncertainty and everything else. So anything we can do to help them, any support will make a huge difference. So just to give you a sense of what's happening at the hospital and in the region, we have 26 positive cases, 5 of which in Orillia, one of which that's as of last night. One was an inpatient in the hospital and regrettably passed away recently as well. So that's the current known amount of COVID-19. We are doing testing every day in the organization, and that testing has been increasing. A lot of it's coming from our assessment center. It's been running for just over a week. And when we opened up, it went from a peak of about 260 on the last Friday in one day, number of people that were seen. Now we're hovering around 50 to 70 a day. And the amount of people that are getting tested are anywhere from 10 to 30 people per day are getting tested at that assessment center. So we know that the tests are being delayed. There's over 10,000 tests pending in Ontario. Our turnaround time is not that bad. It's about 1 to 2 days, but there is a lag in the province. So I fully expect we're going to see a lot more testing coming back positive over the next little while. So that is the current state of testing in our community. I want to share with you a little bit around some of the capacity we've been working on. We've essentially doubled our ICU capacity. We've built a whole new ICU within the hospital over the last week, and we're looking towards increasing that even further if necessary. We've created a COVID unit in the hospital with decreased activity in surgery. We've canceled a lot of surgeries, unfortunately, but we do have the space now to have a COVID dedicated unit. We've also organized and worked very closely with our primary care partners, so the family docs and primary care providers are connected to the hospital, and we're all working together, the same assessment center process, referrals, consults, etc., and making sure we keep everybody safe and maintain services in our community. And we're now looking at how we outreach into the community to come up with creative ways of discharging patients who are still in the hospital that hopefully can move out of the hospital quickly. And we're at the point, and I just was on another call 10 minutes ago, and looking at some of the modeling that's existing of what the demands on the hospital will be, and nothing looks good. So we do need to create more capacity, even above and beyond what we have within our walls. So I'll get to that in a minute, because there really is only one solution to that, and that is social or physical distancing. The concerns from the hospital, we are calling in retired employees, tracking their skill sets to see where they can work, where they can help. We know that our staff are going to get sick, their families are going to get sick. That's what happens in a pandemic. So we need to create of our staff will be addressing the same concerns that everyone else is in the community. The other big concern on top of mind is our supplies of personal protective equipment. There is a worldwide shortage. Countries are preventing the movement of supplies, trying our best to get the supplies in, but that has taken a lot of time. I mentioned these things, and I'm going to go back to the only solution. There's only one thing at this point in time that will change the course of this pandemic, and that is social or physical distancing. I cannot overemphasize that. If that fails, there is nothing this hospital can do to help this community, and I'm being very blunt.
How long do you think that till we see an effect on this? And I do see the questions coming in here about business and how we're going to deal with this, but we'll deal with first here. How long do you believe that, or how long till you think we see a result of this social or physical distancing? And is it the opinion of the hospital that we might have to make more drastic steps?
So I'm not an epidemiologist, so I can't give you answers with certainty, but I will tell you my understanding of social media.
Paul, can you lock the room now? We've got everybody here.
Yeah. So here's my thought. The concept of social distancing means everyone will get sick. That's part of a pandemic, but you spread it over time. It allows two things. One, the healthcare system can respond effectively to it because we're not getting surges in peaks. So when we look at different scenarios of social distancing, the better we are at it, the much has a huge impact on our peak demand. And that's what I'm concerned about, is when we have every ventilator, every room full, that's where I'm most concerned. So that's one thing, but the ramifications of that is you're spreading it over longer period of time. So we are in this mode for longer. So I want to be clear, social distancing will not be measured in weeks. It'll need to be measured in months. We will see an impact on the curve, hopefully within a couple of weeks. And if you're following this on social media, that curve is bending it flat, and that's the flattening of the curve. We should start to see that happening, but we need to maintain it. And what that allows, again, it flattens the peak, but also it allows people to get sick, recover, and come back into the workforce. So we are looking at that as we will have the ability to maintain service and maintain care by having people coming back into the workforce after getting sick, because still the majority of people, the vast majority of people will get sick with mild symptoms and recover and be able to work and come back to work safely. I can offer, Nathan, in terms of timing, but I absolutely need to be crystal clear. This is not a short-term strategy.
Thanks, Carmine. And if you don't have anything else to add, I think that ties in with our next, with Bruce and then with Jill. It doesn't sound like there's a short-term medical solution, and a hospital's our biggest capacity. So the safest way for at least the Orillia community is to keep people from going to work and from interaction. So Bruce, I'll turn it over to you first. Federally, what are we going to be able to do to keep these businesses going, to get cash in people's hands? I've shared a couple ideas with the possibility of eliminating federal income tax for the year for residents' hand and keep these businesses going. Oh, you're still muted, Bruce. I'll get you off.
Okay, thank you, Nathan, and good morning, everyone. Thanks for joining the call. Look, we're picking up on Carmine's outlook. That absolutely jives with the economic and health outlook is very grim over the next few months. Again, we don't want to sugarcoat this in any way, but all of the information that the government has is not paint a rosy picture of the next few months. It's going to be some really tough slugging. And that's essentially what underpinned the government's approach to getting these extraordinary temporary income support programs in place for workers in particular and businesses to be able to ride this out over the next several months. Completely agree that, I mean, all of the social distancing efforts, which has effectively shut down the economy to all but essential services, is all in an approach to limit the spread of the virus and prevent it from overwhelming the healthcare system. So that's the sort of economic pain that arises out of that, and we have to borrow huge here in the short term to make that happen. I think that you're seeing that happening from provincial and local governments as well. And Canada is in a reasonably sound financial position to be able to do that. So just in a nutshell, this kind of thing, the four main areas of work, the programs that have gone into this, the wage subsidy, 10%, that will apply from June 18th to June 20th. That has limits on it, but it's effectively 10%. It will be on your filings for your EI, CPP, and income tax. When you fill out your remittance, you'll be taken 10% off that remittance from now through till June 20th. A business credit availability program, that's essentially $10 billion of extra liquidity into the banking system. That will be managed by your own bank lender, whatever lender you have an agreement with. The monies do come through BDC and EDC, but effectively that's managed by your existing lender. It's just to give them extra dollars that they can use to help businesses out in this period of time. Thirdly, the tax filing has all been changed. All the taxes now, including installments, by the way, will be pushed off until the end of August. The tax filing deadline is still June 1st, or it is June 1st instead of April 30th, but nothing is owing or due until the end of August, and no penalties or interest accumulating throughout that time. The CRA will be handling all of that. Just a final note on the business side of things, the CMA additional, essentially taking mortgages off the books of regular banks so that they'll have a bit more room to be able to manage the volume of requests for mortgage deferrals. This is from businesses, but presumably for the most part from individuals that will give their mortgages. There's been about 213,000 requests so far for mortgage deferral. And so CMHC will unload some of that lending essentially to free the banks up to do that. And two other things just for workers. The main things are EI system to support people who are eligible for EI. And secondly, and much bigger, the Canada Emergency Response Benefit. That's the $2,000 a month for people who are not eligible for EI. So anybody who has had at least $5,000 worth of earnings in the last 12 months and is now in a situation where they have no income because of COVID-19 will be able to apply. This will be through the Canada Revenue Agency as well. And be able to get that $2,000 a month. And that's for a period starting March March 15th for 4 months. So those are the main programs of support at this time, but I would underline that the government itself and evolves, and they have, as with last week's bill that was passed, they have some additional authorities to be able to do those things from now through till the end of September without necessarily recalling Parliament. So that's my report, and I'm happy to take questions.
Thank you, Bruce. For those panel members, do you want to wait until the end? Whatever works best for you.
Should we wait till the end and maybe handle them then?
That sounds great. We'll hold them off. I'm trying to write them down here in the group chat. Jill, your update, please.
Good morning, everyone. Hope you can hear me okay. I don't have the best internet connection out here in the country, so I'm using my hotspot. But I just wanted to comment on Carmine as well. To thank you to all the frontline workers, from everybody in the hospitals to the grocery stores and our corrections and first responders. It's amazing how everyone is coming together, but also thank you to everyone who is following the rules and staying home. I know I've heard a lot in my offices, and so have my colleagues in the cottage country areas, is the influx who are coming from the GTA up to their cottage. And it's not only an extra burden on our food supplies, but could also be on our healthcare system if this continues to spike. So thank you to those people who are staying home. I know right from the beginning, I remember the very first phone call, emergency cabinet call we had when there was a reported COVID Ontarian, and the promise from the provincial government was to be fully transparent with the public at that time, and we've continued to be. We were back into session last week for emergency session to pass a labor bill, which in short provides protection for employees who are unable to work, and that was allowed them to take that time off without a sick note. Also, we're back in for the Municipal Emergency Act, and that was to allow municipalities to fully conduct council meetings electronically during these crisis situations. So we were able to pass that unanimously. It was very important to continue that those people who need to be home looking after somebody who may have the virus or has to be home with kids at this time has that opportunity. The Premier called a state of emergency last Monday. I must say that was quite a few long calls over the weekend that needed to be the next step, and we were acting on the advice of the Chief Medical Officer at that time. And that, in short, closed our indoor rec programs, public libraries, private schools, licensed childcare facilities, and that's in place until March 31st. That was shortly that week, again, followed up by the release of the essential services list. And again, acting on the behalf of the advice from the Chief Medical Officer. All of our ministries came together to put this list in place and going through each one. And we put a lot of time and effort into it. And I will admit there's still a lot of gray areas. I've talked to some of our local businesses, and I added my cell number and personal email address at the beginning if anybody wants to reach out and connect with me that way as well. But there is the 1-888 number that's available if people have questions. I know that's overrun with calls right now and difficult to get through. So if you want to follow up with me, I'm happy to take your call, or if I need to get more information, I can look into that as well. The Minister of Finance released our spring economic statement this past week, and this is really just a first step in a partnership with all levels of government. And it's also great to see at this time all levels of government and all parties coming together. It's a true sign that this is about the health and safety of Ontarians. And it's a very unique and fiscal economic situation that we've never been in. And the health and safety is the most important. So we'll continue to monitor the situation and reply accordingly. But our first and immediate priority is the necessary supports to protect the health and safety of Ontarians. So some of the points from the statement, I'll just give you a couple high level things and then specific to businesses. So we're making $17 billion of resources available to combat the pandemic. This is providing $3.3 billion to support the healthcare system, $3.7 billion in direct supports for people and jobs, and making up to $10 billion available to ensure that businesses have cash flow during these difficult times. So for healthcare, that was of the $2.1 billion is in new initiatives to respond specifically to the outbreak, and $1.2 billion to continue to meet those demands. I also wanted to mention a new website that's been created called Ontario Together. And this is to help the government partner with Ontario's manufacturing sector to meet the challenges of the outbreak, and for companies who are retooling to start making masks or respirators if possible. I know we have some distilleries who are making hand sanitizer. So it's a place where businesses can come together to connect with the government and make these happen. I'd also like to say that on my website, we do a daily update from all the government information that's coming in. I know it's, honestly, it feels like it's changing every hour with new information, but we make sure that that's updated every day. So there's additional information you want to look into, it's there, or the ontario.ca website has lots as well. So the supporting people and jobs, the investment is $3.7 billion to protect jobs and people during this crisis. We're also working with local businesses and charities, as well as existing healthcare services to coordinate subsidized delivery of meals, medicines, and other essentials to seniors who are in need. We had an announcement this week for the electricity rates. So this will help families as well as businesses during this time. And that was setting the time of use electricity prices for eligible customers at the lowest rate, 24 hours a day for 45 days to support people during the increased daytime electricity usage. This will provide approximately $5.6 billion in 2021 to make electricity prices more affordable for eligible residential, farm, and small business consumers. And that's an increase of approximately $1.5 billion compared to last year's budget plan. Supporting businesses, the employer health tax. So during the crisis, the government is proposing to double the EHT exemption in 2020. And through this change, about 57,000 private sector employees would pay less EHT in 2020, including about 30,000 more who would not pay EHT this year. And this amounts to a tax cut of about $355 million. The Regional Opportunities Investment Credit, and I saw there was a question earlier on that said Simcoe County doesn't appear eligible for that. So I'm definitely gonna go back and look into that, and I can get that information to Ellen. I don't know why we wouldn't be included in that, but let me look into it. There's also been tax deferrals. So providing flexibility to businesses that are finding it challenging to meet their tax obligations during the crisis. So between April 1st and August 31st, will be interest and penalty free for businesses who are unable to file and make payments on time for select provincially administered taxes. Also the providing additional supports that WSIB is allowing employers to defer premium payments for up to 6 months, providing immediate relief of up to $1.9 billion. We're also working directly with our municipalities. Steve and I have a daily text conversation going on about local issues. But I think it's just important for people to know that what was released or what has been released at this point is just our first steps, and these will definitely continue as we monitor the situation moving forward. I did leave my information at the beginning if anyone has any specific questions to their businesses that you need me to look into for further information. And I think Alan says he has a question. I guess we'll get to the end. But thank you.
All right, thanks, Jill. If you don't mind hanging around, we'll move on to Steve. And anyone that has any questions for Jill, please save them until the end. Steve Clarke, if you're available. Steve, I'm not sure if you can hear me there. You're still on mute. I'm going to try and take you off. And there you go.
Okay, can you hear me now?
We can hear you now.
Oh, okay, beautiful. Sorry, I was just calling IT, so I will have them stand down. Listen, thanks for the opportunity, Nathan and Alan, and thanks for the outreach last week. I won't get into describing the overall plight that we find ourselves in. I think this group has pretty good knowledge on that. But what I will say is the way our system is working, we have what we have is a primary group made up of all the senior departments of the city. The senior staff will meet once a day and discuss all kinds of issues. Then we have an emergency management group that meets once a week, which also involves Carmine and others from soldiers as well as OPP. And then we have our committee that takes all that information and we sit down and go through daily issues, daily restriction considerations, daily support considerations, and then so that's kind of the formal process. But all day long, the EMC group is in constant contact with many stakeholders and each other. Carmine, as busy as he has been wonderfully available, and we thank him for that. His input truly helps inform better direction. The inspector and Staff Sergeant Watson have been terrific. We're in constant contact with the OPP about a number of issues. I have not had to bother Bruce much to this point. That may change. There are a couple of questions coming up, but Jill, as she alluded to, she and I are back and forth with texting sometimes numerous times in a day. A couple of things that we've done to this point. And again, we had some input, certainly including from Nathan and Alan at the chamber membership. We put a community assistant measures package together. I did that just before I declared the emergency, a state of emergency just over a week ago, because I wanted, as council was supporting it, I wanted them to be able to reinforce that, and did. So we put an emergency fund together of $100,000 to be distributed to critical lead service providers on an as-needed basis. That's mostly for our vulnerable sector. We've waived Orillia transit fees until April 30th. Essentially, that means transit is free. We put some measures in place. Well, what that essentially allowed us to do is to allow customers or riders, passengers to enter through the rear door to better protect our drivers. And the transit system itself is being maintained to a higher commercial grade than that is normally the case, and the drivers throughout their whole shifts are taking sanitizing high touch points. We have waived the tax penalty through June 30th for both residences and businesses. We've waived water and sewer penalty through June 30th as well for residences and businesses as well. What that essentially means is that you do not need to pay those bills right now. If you can, please do. If you cannot, you have until June 30th. As with all the measures we're putting in place, we're going to revisit what we do have in place, and if they need to be modified, we will do that. We have deferred, so we waived parking fees until the end of April, again to be revisited. Deferred implementation of a municipal accommodation tax, which was supposed to go into effect April 6th. It's now September 1st. We've deferred the second annual intake of the Downtown Tomorrow CIP, or the Community Improvement Plan. Essentially, that gives businesses more time to put an application together, which may help them when we come out of this thing. We've also allowed residences and businesses, for that matter, to put an extra one bag of garbage out each week with no tag, because we believe that there may be some cleaning up of some things, partly because of the virus. And we've launched the hashtag Orillia Cares campaign to share some of the more positive stories that are definitely taking place in our community. The other thing is our economic development department. We still have our departments, they're live. Some people are working from home. In the city limits, physically, we have at least one person from each department there, so that somebody can speak to a human being when they have an idea or a concern. And our economic development department truly has been in constant touch with many in our business community, and that helps to inform the emergency management team. I will tell you, not just myself, but there is growing concern that we still do have a number of businesses open, and some of them are doing a wonderful job at practicing sanitizing of high touch points and physical distancing. I reference Home Building Center, Home Depot, Costco, even Apple Annie's, for goodness sakes, they're doing a terrific job. But there are some places that don't seem to quite get that yet, and certainly some individuals who don't seem to understand the gravity of the situation we're in. As I like to say, this isn't a drill for a pandemic. This is a bloody pandemic, and we need to treat it that way. My point for saying that is we brought in some measures of support. We over the last few years, we've built up a reserve called our tax stabilization reserve that prepares us for instability that could affect taxes going forward. So we've got a little bit of a cushion in there, and that's where we have allocated the first $100,000 in support for the community from. My point is, we are taking a staged approach to everything that we're doing. Whether it's support, and we put out a package. If we need to revisit that, then we will revisit it. We also are bringing some restrictions into the community. We were contemplating doing an essential business strategy, and actually within the started our meeting at 2 o'clock, and I think the Premier came on at 2 o'clock and did that for us. So I thank Jill and the Premier for that. We've also closed down playgrounds, skateboard park, and basketball thing because there's the opportunity for transmission there, and we will continue to look at the restrictions. If there's compliance, then that's wonderful. We'll thank the community. If there is significant non-compliance, that's where we will turn to our OPP. And I know one of the conversations Jill and I have had is the deputization of our municipal law enforcement officers to help at least in some of those situations. And I understand that conversation is ongoing at the provincial level. I will say the decisions that we are making on a daily basis are well informed by Carmine, and certainly by our Dr. Greener at this SMDHU, the health unit. And it'll also be informed by the level of compliance that we have. So we're taking these measures to mitigate the effect. I know one thing that will be top of mind to chamber members is how the heck do we come out of this thing? And I know the province is contemplating that now, and so are the feds. And we're doing that as well. I'm actually tasking 3 people today to start contemplating the city's involvement in that strategy. And I would suggest these are 3 very capable people, and I'm going to suggest, as much as they will be meeting, that they will definitely need to be doing that with the chamber, the CDC, and the DOMB. And if there's another stakeholder that I missed, please fire me that message. I think that's kind of an overview at a high level, but just like Jill, Bruce, and Carmine have indicated, certainly glad to take questions. Thank you.
Listening to all this, we're going to have to review this meeting and take all of these points and get them down kind of into something that our members can have a look at. Thank you for that, Steve, and the update. I had a suggestion here that maybe after those first 4 speakers, we take questions that relate to Carmine. I've taken one on text directly for you. Do we know the possibility of someone who has been infected with COVID-19 and has recovered, what their chance of getting reinfected is, or infecting someone else? Did we? I can't tell that if I got that. Steve, thanks. We're going to jump into a couple questions here for the first 4 people. Carmine.
Sorry, Carmine's unmuted now. Yep.
Okay, I got the question. Thanks, Nathan. So, to the best of our knowledge, and this is confirmed with infectious disease physicians, once you are infected, typically you generate immunity, and unless the virus changes over time, which it does from season to season, like the flu, but in this pandemic, the feeling is once you are infected and recover, you can't get it again, and you're no longer shedding virus. So the peak time to shed virus is when you are at your sickest. We recognize that sometimes people are infected before they feel symptoms, which is always a very difficult thing because you could be transmitting without knowing, and that's why social distancing is so important. But once you recover, the feeling is you can't get sick again, and you can't transmit it, generally speaking.
Perfect. Thank you, Carmen. I hope that answers that question. Next, I've got Dan Landry would like to ask Bruce Stanton a question. Dan, if you give me a second, I'll unmute you.
Thanks, Nathan. Good morning, everyone. The question is, I think more to Bruce, but to everyone. Bruce, as you can appreciate, our office has been a conduit for concerns from local business. It should be no surprise that we're hearing that cash flow and fixed costs are a real issue. Very simply, the landlords are really looking at things to show universal action from the banks and understand the banks are to defer mortgages, but some are very reluctant to approach the banks individually for fear of being on the radar for the banks and affecting the future credit rating. So, just putting into, I'm sure you're hearing, but most landlords are saying they can probably defer for up to 60 days and are willing to take the hurt, but they would really like some idea of what the medium and long-term flexibility is going to be. Banks and are encouraging some sense of universal action, whether it's, freezing balances, revisit payments down the road. But I think in the long term, it sounds like this will be very important.
Thanks, Dan. I think I got most of that. The sound was kind of breaking up there, but I would certainly encourage people who are having businesses, organizations, even landlords that need to get through this period of time, that they should be talking to the lender with whom they have a regular relationship. A lot on 2 fronts, both the business credit availability and also through CMHC. Those federal organizations are putting money, creating capacity for existing lenders to take on greater risk. That won't happen, of course, unless those borrowers are able to get in touch with their bank. Yes, admittedly, they're getting a lot of requests right now, but they should open that conversation up. And I don't see any worries about this somehow flagging them for some other kind of issue with credit down the road. All of these measures, of course, are temporary, but at the same time, these are massive amounts of cash for the lending system to be able to get that money out through regular channels. And it's far easier to do that through banks that already have a relationship than trying to do that through a federal agency. I hope that answers the question. I mean, happy to sort of take that further, perhaps offline. Don't hesitate to give me a call at the office or by email, and we'll get that over to you.
Thank you, Bruce. Do you know if there's been any conversation at the federal level about allowing banks to waive interest as well as principal on these loans?
I'm not aware that is in the offing at this point. Certainly at the federal agency side, waiving interest penalty on taxes and things of that nature, yes. But as far as the banks go, I think combinations of principal or interest payments being deferred is probably a discussion that could be had. But I've not seen anything specific, any kind of federal measure that would, specifically address interest on existing debt.
And one more for you, Bruce. Has there been any conversation about increasing the wage subsidy from the 10%, the original 10% announcement?
Yes, this is something that has been an ask both of our party as well as the New Democrats, I think the Bloc Québécois as well. What seems apparent to many of us is that of all the measures that were brought to bear here in the last week, and as the government has announced in the last several weeks, small business generally has not necessarily been given a great deal of flexibility in terms of getting through this. Workers, yes. Big businesses, there's capacity for backstopping bigger business failures. That there will probably be some here, especially in the oil gas sector. Airlines are going to be under some severe economic pressure. But the wage subsidy, in my mind, would be the very best way to help that out. That initial wage subsidy is going to cost about $5 billion. I think that's the number. Don't quote me on that, but it's in that neighborhood. That could be increased to help out. Of course, that's just for the wages that businesses will continue to be paying out in that period from March 18th to June 20th. And I should say that's June 20th now. That's one of the things that will probably be under consideration to change going forward. But there is some pressure on to move that wage subsidy up. We've heard some, just a final point, some European countries are subsidizing wages allegedly in the 75% range. We're told that while that may be true, initially, a portion of that 75% is also in the form of a loan. So it creates additional debt for the business post-COVID-19.
Thank you. I'm just going through. You seem to be having the most popular questions at the moment. One quick one as I filter through for Steve Clarke. Steve, has the city decided whether or not to close Scout Valley yet?
You can hear me okay, Nathan and Alan?
Yes, I've got it.
Thanks. Question. At this moment, Scout Valley is open. At the moment, Cooch Park, Tudor Park, all the parks are open except I think we've closed the dog walk, the off-leash parks because of the confinement of the space. So right now they're open. My suspicion is that will change. We're actually monitoring behavior in the parks. We do see groups on occasion walking together. If that behavior continues, the parks will be shut down. If there's compliance, then the parks will be left open. There may come a time, make no mistake, again, we'll be informed by the health unit and by Carmine and by others, that we could get to the point where we are telling people to stay home and not just requesting it. But right now they are open, so if you're going to use the parks, just exercise, social distancing, and the other 4 or 5, 6 things that we're supposed to be doing to help flatten the curve. And I missed a lot of Carmen's presentation, although we've spoken a lot in the last couple of weeks. But that is so important, because if we don't do that, it's going to create the surge at the hospital, and that's when the possibility of being overwhelmed will occur. So these things that are out there right now as solid restrictions need to be adhered to. The things that are requests need to be adhered to. And if they are, we can leave things like Scout Valley open. If not, we'll close it.
Thank you, Steve. One more question for Bruce. I'm just trying to find the exact wording here. It was in regards to countries that have seen an overwhelming infection rate. They have said the only way to flatten the curve is to test everybody and institute a mandatory lockdown. Do we see Canada going in that direction? Have you been privy to or around any discussions about those considerations?
Yes, that direction is right. Other countries who have taken on large amounts of testing, and then with the idea of essentially sequestering or partitioning people who test positive to keep them out of society so that, you know, non-COVID-19 people can go about their day-to-day. That is, that's an evolving situation right now in terms of the ability to do that across a country like Canada, especially with the kind of pressures that are already on the system. You've seen the numbers. This is done primarily at the provincial level, as we've seen. I'm sure Jill might want to comment on that, but there, even as we sit now, there's a degree of backlog in respect to getting those tests through and getting those results out. But that seems to be, as this goes forward, that's going to be an area that will ramp up the amount of testing to try and make sure we can separate people who have the virus and allow those who don't to be able to get back to work. I don't think we're there yet. And stand by for, on the second point, around measures to further confine people to isolation. As Steve mentioned earlier, there are still people out there that are not taking this seriously. And the government has not taken anything off the table in terms of bringing in further measures, including potentially smartphone, cell phone surveillance, to be able to enforce those measures. The Quarantine Act took effect this morning at midnight, and will apply to all people coming across ports of entry in Canada. They'll be under mandatory quarantine for 14 days, and that'll be enforced by fine or potentially even imprisonment. So you can see, even in the last 7 days, the enforcement side of that has ramped up. If people don't start taking this more seriously, you'll see more of that.
Thank you, Bruce. Next to Jill Dunlop. Question regards probably to our area locally. What is being taken that our local supply chains are intact, and how can we stop people from outside of Simcoe County contributing to the load on our healthcare system and our smaller supply chains here?
Thanks for that question. I think I kind of mentioned that at the beginning, as well as that we've been hearing from locally in Orillia and the other end of the riding in Mid, that we have a lot of our cottagers who've decided that they'd rather be in this area than in the GTA right now. So it is an extra burden on our food supply here. You know, we're ready for them in the summer. We're not necessarily ready this time of year, nor is our healthcare system if they end up getting sick at this time. And like we said, there's, Bruce was just mentioning about the backlog in the testing centers. And I know we were on a call last night talking, I think maybe Carmine, correct me if I'm wrong, the reagent for the test is in backlog as well. So I know this has been brought up at Cabinet by myself, as well as some of my other colleagues in the Muskoka area and up in Owen Sound, that they're seeing the same thing. And I think it's just, it's important we're getting that message out through all means, is that people really need to stay home. I mean, this is a great place to be, and I can see why someone in the GTA would want to be here, but we really need to all be doing our part right now. This is not about what we want to be doing, but what we need to be doing, and staying home is most important. I talked to some people in a tiny township yesterday, and she's awaiting cancer surgery, which is now postponed, and her husband has COPD. They live on Georgian Bay, and now all their neighbors, the cottagers, are coming up, and you can imagine how discouraged and upset she is. And she's a person who is at extreme risk for contacting this, and given her health situation and age as well, it kind of a double whammy. So I know we'll continue to talk to the Premier to get that message out there. I think with those of us who are working from home or at home every day watching these news updates is very important, and people are, send me information and say, hey, can you make sure the Premier says this next time he's up? So people are listening to the Prime Minister as well, and to have those people up there telling people to stay home, I think is very important, because it is a burden on our systems here in our small areas.
Thank you, Jill. We've got a question from Ted Hewitt here in regards to Sunshine Superwash. So a very local situation. And Ted, I get to your question. You're trying to figure out whether you're essential or not, but I think the bigger question is, how are businesses supposed to determine what's essential? The list in Ontario was rather large compared to Quebec, and that's to keep our province going. I understand that. But Ted seems to have an issue getting clarification from his association and the province. How do we get those questions efficiently through the provincial government to find out whether or not we should be going to work?
So there is the new 188 number. I don't have it in front of me, but it is on my my website. I'm sure if we Google it, we can come up pretty quickly. If Ted wants to give me a call, my cell number was at the beginning, and we can discuss it. We're not looking, like you said, we need to keep the province moving as well, but the health and safety is priority. I have spoke with a few manufacturers in the area who have talked about the things that they're doing within their own companies and between shifts to clean between each shift to protect the people who are working, because those people are going home and need to protect their families as well. So I'm happy to talk to Ted offline, and also to anybody else who is kind of in that gray area, who's questioning whether they are essential or not. And Mayor Steve had mentioned about we have an emergency order coming for municipal law enforcement officers to also play a part in looking at businesses that are open. But I think it's really important that we're not looking to shut people down, but we're looking at it from the health and safety perspective. And if people are doing what they can to social distance and to keep their employees safe and the public safe, if they are in contact with the public, that is the priority. But I'm happy to have those conversations.
Thank you, Jill. I'm just reading a question here from Mike Hearn. And Mike, maybe I will try and unmute you and give you a chance to ask your question to everybody, if I can find you on the list. Just a moment. He seems to be gone. The question is from Mike to everyone. While I'm not underestimating the severity and complexity of the problems facing us, how long are we going to accept these less than half measures that are going to leave millions of Canadians at the risk of losing everything, homes, businesses, and more? My business has now lost the money set to carry us through the summer. Please do not say loans. I think Mike's echoing the concern of most small businesses in our area. Sorry, I think Mike's saying that most of the businesses have been, these loans don't seem to be doing enough for them to carry going forward. There's, at least in our community, Dan's question about renters, there's a big concern from these smaller businesses that they won't be able to continue should this go on any longer, and they don't want to take on any more loans to try and get through this. I'll leave it open to anyone to answer that question.
Well, he's absolutely right. I mean, for those businesses that have had to shut down because of not being essential, that represents a loss of income, and with continuing fixed costs that will make it extremely difficult to get through a longer period of time that we have to maintain this social distancing. And it would appear we're on a trajectory to see that, in fact, over the next several months. This is not going to end anytime soon. So he's right that we don't want, there's a degree to which lending and more borrowing is simply many businesses won't have the capacity to do that, even with a good lender. even with these additional measures in place. So the pressure is already mounting to have the government step up and do more in that area, such as in the wage subsidy. That's if you have employees, but we're going to have to see some greater measures on the part of government. Federal government has probably the greater degree of funding available to it. It can borrow more. It's one of the things we're watching too. I mean, all countries are in this, and so the strain on global lending is going to be immense. So we need to keep an eye on that as well. But we'll continue to talk about that.
All right, thank you, Bruce. Thank you to Jill and Steve. We're going to have to stop that question period and move on to the second part of our meeting. I'm sure we could ask questions all day. I do understand that we just don't have all of the answers right now. And I hope that we can keep the lines of communication open between you, the city, the chamber, and our businesses to do whatever we can to come out of this in as positive a position as possible. Timpano, if you're still there, we'd like to move on to what you have to offer us today in regards to the legal situation with laying employees off and how to manage this.
Hi, Nathan. How you doing? I am definitely still here. I've been listening in, and I want to thank everybody for the information they've been providing. I know this came together really quickly, and for everybody to have cleared their schedules to be able to put this together, I just wanted to express my appreciation to all of you for doing that. I guess I'm still on. I guess I'm at the little kids table. Looks like I don't have a video hookup here, which is fine. So just, oh, there I am. Yeah, I think so. So for my part, it's about, you know, I had a whole bunch of outlines about some of the assistance that are being provided, and I think everybody's done a really good job of covering that. My piece was to talk to people about, you know, how do I manage my business right now? These are not normal times. If I'm lucky enough, or you know, however you want to choose to view that, to be on the essential business list, how do I manage my workplace right now? How do I care for my employees? What can I do to keep them at work? And I have to tell you, you know, from what I've been getting from my clients, the largest number of questions I've been getting, it appears that employers are really concerned about making sure that they can keep their employees at work for as long as possible and keeping them safe and healthy while they do so. And that's a real testament to small business owners who, you know, I'll park my biases for a moment, but it's a real credit to them to have that kind of care for their employees. So I did have some slides, Paul, but I don't know that they're really that useful. I can just kind of really briefly kind of talk from the top of my head about what I wanted to talk about. So first of all, the list of essential businesses, I think it was asked earlier, Ted Hewitt was asking about that. And Jill, there is that hotline number. I haven't actually called it myself on behalf of a client, but I know that the number is 1-888-444-3659. And I think that is available from 8:30 until 5 o'clock. It looks like it's available 7 days a week. Ted, I don't know if you've already tried to call that number, but I understand that they can assist in terms of helping you determine whether or not you're an essential business. And I believe there is a possibility to apply for an exemption if you're deemed not and you think that you are. So I don't know if that's helpful, but to start with, if you're deemed to be essential business and you're continuing to operate, certainly the very first consideration for everybody in all of this is how do you do so in a safe manner for your employees? You don't have to stay open if you're an essential business, but if you're staying open, obviously first and foremost is you have to do that in a way that you know, encourages and supports all of the directives that we're getting from our public health officials. So physical distancing, obviously, cleaning down surfaces as much as possible, all the stuff that we're hearing. But I would also tell you, these aren't normal times, right? So if you're operating a business, encourage your employees to talk to you about their health. And I know that that's a taboo topic under normal circumstances, but it's important for you to provide a safe working environment for your employees, right? So in a pandemic where there's a potential for the virus to be introduced into the workplace, you absolutely, as an employer, have the right to ask your employees the screening questions that are being provided. Have you been in contact with anybody? Have you traveled recently? Has anybody in your home been diagnosed with COVID-19? If you're feeling at all unwell, tell your employer, talk to your employees, let them know to let you know. Certainly if they have no acute respiratory symptoms, none of the more obvious signs of COVID-19, simply because they're unwell doesn't necessarily give you the right to require them to go home. But if they do exhibit those symptoms, you absolutely have the right to require them to go home. You have a duty and an obligation to provide a safe working environment for all of your employees. So as an employer, you do have the right to require them to go home, and you are allowed to ask them, again, your questions around medical information have to be restricted to those regarding COVID-19. So you certainly can ask them for that information, and confidentially, of course. All those discussions remain confidential. And if they are exhibiting symptoms, to ask them to have an assessment and to follow the directions given to them by their healthcare provider. Those are all good suggestions. And again, this is just a new environment that we're in. Normally you can't get medical information from your employees. In this case, you certainly can. I'm going to go through the rest of my stuff really quickly because I think questions and answers are probably going to be the best way to serve everybody. But in terms of working remotely, I know there's a lot of talk about people working from home. All I would tell you is it's an interesting time, right? I know a lot of workplaces have talked about it, not necessarily implemented it. Certainly the motivation is there now to do so. But if you have employees working from home, very important to have a good discussion with them now, if you haven't had it already, about expectations, about performance, about making sure that you're in constant communication with them. Certainly, you have to make sure that they have the proper tools to be able to perform their work from home. Do they have high-speed access? Do they need a printer or a scanner at home? Do they have a mobile phone? I think almost everybody does now, but is their mobile phone able? Can you communicate via instant messaging all the time? One of the questions that may or may not come up is if you're requiring an employee to work from home and they're using resources at home, is there the possibility to reimburse them for some of the expenses that they might incur because they're working from home? The other piece of that is I have had questions from employers who are saying, well, my employees are requesting to work from home. I'm happy to provide that. Can I ask them to take a reduction in pay? And while you certainly may, I would probably suggest to you that if you're able to manage during these times without going to those lengths, this is the time when most people are having a very difficult time financially. And you run into this situation where, depending on the amount of the pay reduction, you could find yourself in a situation where the employee is alleging a constructive dismissal because you've unilaterally changed a fundamental term of their employment contract, and that can be pretty messy. So while it's possible, certainly my recommendation is not to request that. We talked a little bit about all the financial measures that are already in place. Two questions that I'm getting a lot of are, we talked about what happens if an employee shows up sick, but what happens if an employee just unilaterally chooses to stay at home? They're not sick, they're not home because they have to provide care for a loved one. They're not home because they have a child who's at home because their school's been closed. They just have a fear or an anxiety right now that they don't feel being at work is the best thing for them. And the only answer I really have for that is communicating with them is extremely important. Make sure you're doing all you possibly can to provide a safe working environment for them. They don't have an unlimited right to just stop working, okay? But managing this is going to be very difficult for employers, I think, going forward. There is a fear, there is an anxiety from some people. And I think you want to tread lightly on that issue. They may not qualify for employment insurance if they unilaterally choose to stay at home. The landscape is shifting every day, so I'm hearing various things from various people. But it's definitely a possibility that they wouldn't qualify for EA if they unilaterally choose to stay at home. That may change, okay? But if they choose to stay at home, you can certainly talk to them about using vacation pay or any kind of personal days, sick days to provide some compensation for them in the event that they don't qualify, okay? The deferred payments and WSIB relief measures to provide financial support for employers, we already talked about that. In the event that that you're choosing to stay open, the wage subsidy is not enough to be able to justify keeping all of your employees. There are a couple of programs I just wanted to briefly touch on that you might be interested in looking into. You can look at a work sharing program. It's a program that's offered by the federal government. The application process is a bit extensive, but what it provides you to do is to identify a group of employees within a work sharing unit, and it requires their agreement to unanimously reduce their working hours by the same percentage to keep everybody at work. And if that work sharing plan is approved, then they have the ability to get some income in the form of employment insurance benefits over and above their actual earnings from their workplace. I explained that very poorly, but I think you understand where I'm coming from. It's not a quick process. Like I said, it's a pretty extensive application. It takes about 30 days from what I understand, and I don't know what kind of backlog there might be right now. But that's certainly an option to consider in view of potential layoffs. You could look at a work sharing program for your employees. The other thing is a sub plan, a supplemental unemployment benefit plan, where the employer submits the sub plan that goes to Service Canada, I understand, for approval. If approved by Service Canada, then it allows you to top up the benefits that are provided by employment insurance. For example, right now for EI regular benefits, there still is a 1 week waiting period, as I understand it. The waiting period has been waived for EI sick benefits. But if you have a sub plan, it allows you to potentially provide your employee with 1 week's of pay up to 95% of their earnings while they're in that 1 week waiting period. And then going forward, you're allowed to top up their EI earnings to 95% of their regular salary. So that sub plan is certainly an opportunity for you, again, to try to keep some employees at work and top up their wages. The last comment I just had was in terms of layoffs. If you get to a point where you simply can't continue to operate and you have to undergo some layoffs, do it in writing. It's important to have a letter that you've given to your employee stating that they're on layoff. You don't have to list in that a recall date. You don't have to have a defined recall date. If they're on a temporary layoff, the layoff can't be longer than 13 weeks in any 20-week period, provided that if you continue to provide group healthcare benefits or you're paying into a pension plan, you're providing some other regular monetary benefit for your employees, that 13-week period could be extended up to 35 weeks within a 52-week period, okay? So that's certainly something to consider, the temporary layoff option. I'm not sure if there's any discussions at all at the provincial level to extend the temporary layoff provisions under the Employment Standards Act. It's certainly something I would encourage them to look at. The only issue with conducting layoffs that you need to be aware of is certainly Employment Standards Act permits employers to provide temporary layoffs. There is a risk, however, that if it's not permitted expressly in your employment contracts, that an employee may suggest, and it's in fact supported by case law, that you don't have the right to put them on a temporary layoff, which means that you could be looking at a constructive dismissal. and what I would tell you is these are uncertain times, and everybody's working together. I don't think it's in an employee's best interest to claim constructive dismissal and be without work during these times and be out there looking for a new job. And I certainly appreciate the fact that employees understand what employers are going through as well, and they're willing to work with you. So, so I think if those are your options and you have to conduct layoffs, you're worried about the potential for a constructive dismissal, I really don't know that you have much of a choice. I think it's a risk that if you're willing to take and try to manage that as you go. Okay. I think that's really about it. I don't know if there's anything else specifically that you wanted to cover. We can look at questions and answers, Nathan. I know that there might be some questions around filling out records of employment and stuff. If there are, we can answer those as we go, but I think we're already getting late on time.
Thank you, Tim. I think you hit the important part of that at the end there. I've spoken to other business owners and we've had a question here in regards to some of the consequences of maybe not going through this process. But because, waiting for my internet to come back, do you feel that because the volume of issues that we're going to see, that employers might not be potentially as exposed to risk as they normally would?
Yeah, I think that's definitely the case. You know, time will tell, right? Time will tell. I think that there are certainly circumstances where an employer voluntarily chooses to make changes to the workplace, and that could result in what's deemed to be a constructive dismissal. I think if you're deemed to be a non-essential business and that is forced upon you, I would expect that our court system would have grant some leeway to employers in that scenario, right? Everybody's trying to do their best.
One question here, Tim, you cut out there. This is from one of the people watching. If an employee is nervous about working and the business is slower, can they lay him or her off?
Yeah, they absolutely can. You know, there's a code on the ROE. I think it's code A for shortage of work. So if there is in fact a shortage of work, that's certainly an option to consider. I think there are other options as well on the ROE. There's some concern about whether if you indicate, I think code N is one of the codes for a leave of absence. In view of the volume of applications going in right now, I'm not sure that Service Canada has the ability to conduct the investigations that they might normally conduct when an ROE is submitted with a leave of absence. But there's certainly different reasons for a leave of absence. A leave of absence because you're just choosing not to work in ordinary times is far different than a leave of absence when you're fearful about your health. So I would be inclined to suggest that a leave of absence would be the accurate code on an ROE under those circumstances if there's not a shortage of work. If there is a shortage of work, then certainly code A is the one that you would fill in, and that's fine. They'll be entitled to regular EI benefits. Again, if there's not, the leave of absence code is one that I would use. But the issue then is, you know, there's some risk that the employee may or may not be entitled to employment insurance benefits. So something to consider.
Thank you, Tim. I'm getting texts and emails here that people have to leave. So I'm going to ask Bruce and Jill, if you have any closing comments, we'll let you go. And then we'll move on to, we've got one last speaker, Caleb St. Pierre, updating us on the wage subsidy. But if Bruce and Jill have anything that they'd like to add before they go, I'm sure you've got lots on your plate today.
Thank you. Good report by Tim. Nothing much more to add there, but I agree with him on the EI issue. If anybody is having to leave work because essentially of a COVID-19 shutdown or an order that they're non-essential, shortage of work certainly plays into it. Mark that COVID-19 is the reason for the leave of absence or shortage of work on the record of employment. And EI has in fact bolstered their roster of staff to handle what is going to be an avalanche of applications. And they are simplifying and expediting these applications much more than they ever would in the normal case. Normally it's a 28-day waiting period. They're going to move these through very quickly, as fast as they can, to get money out to people. But thanks again for everybody. Thanks for inviting me on the call. Happy to do this again if you see fit. And we'll be in touch. Stay in touch with my office if you have any other thoughts. Thank you.
Thanks a lot, Bruce. I'll turn it over now to Caleb St. Pierre from Sawatsky Professional Corporation to update us with his information on the wage subsidies.
Hey everyone, so just wanted to go over some things quickly. We've been getting a number of questions coming through our office just on how this looks and whether or not there's an actual application process for this. So you may have heard some of the announcements, and it was mentioned earlier on in the meeting. It's going to be 10% of wages paid out in the next 3 months. And it was mentioned earlier, I believe as well by Bruce, that time period could be expanded, but we don't know that yet. And the maximum is capped out at $1,375 per employee. And for larger employees, the maximum total is $25,000 per employer. As far as applications for this, there's no real application process. It is fairly simple, and it is immediate cash in your hands to hopefully retain staff for the interim. And basically all that is required, you need to reduce the amount of source deductions that you're filing on your monthly payroll filings. This reduction can only come from the income tax withheld portion. CPP and EI need to be remitted regularly. But the income tax portion can be withheld. Again, that's up to the $1,375 per employee. And you keep that in your bank account, and we're assuming, as it stands right now, everything will be taken care of when the T4s get filed next year.
So is it taxable to me or taxable to the employee?
So this is directly to the employer, and it's something, as far as it stands right now, this is going to be something that is taxable. It'll be taxable through a reduction of expenses. But again, we're assuming there's going to be more that comes in the near future.
Any other questions for Caleb there? Now, I do have a note here that Caleb will be doing a much longer conversation on this topic next week. And just to remind everyone, this information is changing daily, if not hourly at this point. So whatever Caleb's sharing today, I'm sure will change dramatically by the time we do that next week. Do we have a time yet for that, Caleb?
I don't believe so, no. I think we're looking more towards the end of next week, though.
Okay, we will set that up with Alan and Paul at the Chamber, and we'll make sure we get that invite out to all of our members. I know that we've lost most of the questions, or people here to answer questions, but if there's anything that we missed, please feel free to share it with Alan and Paul at the Chamber. Alan, if you want to jump on and just update your contact info or email address where we want these questions going to, and we'll make sure to get them to the right people.
Yeah, exactly. So the real big challenge right now is that we've got a lot of emails, a lot of calls, and can only answer so many calls. We're down in staff, obviously, throughout this thing. And what we've done is we provided a link for you. I just put a old tech solution in there, which is Tap-a-Talk Community. You'll see the link over in the right-hand side chat room, and I'm gonna do one of these share screens and just give you a quick little run through it. It's not high tech, but what we're asking you to do is work with other chamber members, add your questions here, build this community, work together, and together we will solve this whole thing stronger together. So it's just a little message board there. If you have questions, please put it in there. Please collaborate. There's not any, there's one reply so far, but it needs the community to work on this. We will be having a Zoom training on Tuesday with Chris, our librarian at Lakehead University. I did get in contact, speak to Chris Glover. He sent me a message, and Dr. Linda Rottenberg is going to provide a lot more informational training sessions for our members. Going to try to get that on meetings. And obviously when Chris gives us the Zoom training, we'll be able to work out some bugs. Obviously, most of you know we got some hackers on the board here today. And we couldn't take in some calls. If you are talking to other chamber members that were upset they couldn't get in, we just had to stop allowing new people into the room. And it's unfortunate this time that you got people that are trying to destroy when we're working together. And we also have another session coming up. I'm getting a lot of chamber members who are reaching out and saying we can do a meeting. So Helix IT is willing to do how to work from home. I'm speaking to Mark over at Orillia ProNet to get another program as well. So watch your emails. We're gonna do this. This is how we're gonna meet. And we might even be able to have a business after 5 in this room. And that's all I have for now, and wish all of you well, and stay connected, and we'll work this through.
Thank you, everyone, for your time this morning. I hope we got to answer some of your questions and provide an update as to what's going on in our community. I encourage everyone to stay connected with the Chamber, and we will do our best to get the information as we can, get the information as easily out to you as possible, and something that hopefully benefits what you're doing and helps get over this hurdle that we're all dealing with. And I encourage all of you to stay safe and protect your staff and families as best as you can going forward. Have a good day.